ProMedica is a 13-hospital system that serves Northwest Ohio and Southeast Michigan. And on the imaging side, we do about 800,000 studies a year and growing. So we actually started using our PACS as a VNA or enterprise PACS about 7 years ago when a cardiologist needed a viewer so he could see his images in the operating room. Within our enterprise management strategy, we include cardiovascular, cardiology, radiology, maternal fetal medicine, OB/GYN, and we are working on solutions to do encounter-based visual light images. And that would be for wound care or dermatology, SANE imaging, and pretty much any other workflow where they take images and don't have a solution for it. We have recently come up with a solution for encounter-based imaging as well, which is pretty exciting. So we've had multiple meetings within the past few weeks, actually, and the more people we talk to, the more people are wanting to jump on board. An enterprise management system is important to a health system because you don't want to have your images in multiple systems. In our case, we archive multiple systems to our PACS because our PACS is the single system that's integrated with the EMR. And rather than integrating multiple systems, we integrate one system. And rather than having images in multiple systems, if we store them in one location, we cut down on storage cost and eliminate the support for multiple systems. In our case, it was very important for us to integrate with Epic because Epic drives all of our workflows. We actually start in Epic, and Epic drives our PACS solution. It drives our cardiology solution, and in all cases, it drives the physician workflow. So they start in Epic, and they end up with images. In most cases, they end up with a solution that feels like it's just one system because it's so tightly integrated. So we truly do have an image-enabled EMR, and we have probably 3 levels of integration. We have one integration where the Sectra light viewer is enabled where right within the body of the study, they can see click images, and the physician would click images. If you have access to Epic, you will have access to those PACS images as well. We have a integration where the radiologist can do bidirectional communication with Epic, so PACS can drive Epic and Epic can drive PACS. We also have a technologist, we call it a technologist workflow, where they can launch Sectra PACS directly from Epic and do their QA right from PACS. So in every one of our workflows, it feels like one integrated EMR integrated solution. So the workflow that the radiologists will have, they will be looking at a single patient and they will be able to see the entire history, including cardiology, cardiovascular, and now OB/GYN, all within one single file. They do not have to go to multiple systems to look at those images. So it's improving patient care because we're consolidating images all in one location and integrated with the EMR directly. So when we integrated the other imaging solutions within our PACS system, we really didn't have to make any special adjustments or configuration to our PACS. The display protocols within the PACS actually already separate those images. So the physicians just started to notice these extra images as a prior without any additional clicking or hunting for these additional studies. So I would say to someone who's looking to purchase a PACS or a VNA, I would look for a vendor that could do it all in one location. Because if you are going to purchase a VNA, you're going to have to migrate data to that VNA in the first place. So in our case, we find that having everything in one location is more cost effective, but it also serves us from a technology perspective as well. So we don't have to support 2 systems. And we find that Sectra manages that system quite well. I would say the primary reason we decided to stick with Sectra is because they have proven multiple times that whatever we ask them to do, they will follow through. Probably the most important thing when I'm looking for a vendor, I'm looking for a vendor that has full knowledge of the source code. And Sectra is probably, if not the only one that I can think of that has written all the code for their Sectra PACS and their VNA, which is really just one system. I would say one of Sectra's best kept secrets is a solution they call direct archive access. And when I look for VNA vendors, I'm looking at storage. How can we deliver those images to the radiologist as fast as possible, and how can we manage that storage? And with Sectra, we can archive those images, and using what they call direct archive access, we can read those studies directly from a long-term storage solution. Because of technology constraints, it's difficult to provide high availability solutions when you have, let's say, 150 terabytes, 200 terabytes of storage. But when you can offload that data and the PACS doesn't have to own that data and read it directly from your long-term storage, which is already redundant, that's very attractive to a health system. One of the things that separates Sectra from other vendors is when you call their support desk, you can talk to multiple individuals who understand their system front to back, and that's because they don't have multiple departments where they're going to be passing your ticket around to. For example, I've worked with multiple vendors where you're talking to one team that feels like they're an entirely different operating unit, and you're working with them on PACS, and you have to open a separate ticket just to work on VNA work. But with Sectra, you open one ticket, and you could be talking to the same engineer whether you're working on your PACS or your VNA. So I think that's one thing that really sets Sectra apart from other vendors.